medical, scientific, professional, academic. Welcome to Midpresso Podcast.
Diagnosis and prevalence of posttraumatic stress disorder. Post-traumatic stress disorder, PTSD, is a condition that arises after a single or repeated traumatic psychosocial impact on an individual's mental state. The diagnostic criteria were first formulated by the American Psychiatric Association in 1980. In 2018, the publication, Post-Traumatic Stress Disorder, From Diagnosis to Prevention, by Xuerong Miao in the Medical Military Research presented the results of an analysis of over 3,000 publications from the PubMed database related to PTSD. This research provides a current understanding of post-traumatic stress disorder associated with military trauma and contributes significantly to the interdisciplinary understanding of PTSD. Definition and differential diagnosis. Currently, PTSD is defined as a chronic disabling psychiatric syndrome with significant functional impairments. The etiology and manifestations of the syndrome are not always clear, making diagnosis challenging. According to the recommendations of the Diagnostic and Statistical Manual, DSM, PTSD is classified based on 20 symptoms divided into 4 clusters: intrusion, active avoidance, negative alterations in cognitions and mood, alterations in arousal and reactivity. Modern PTSD diagnosis relies on the criteria of stressor exposure and requires the presence of a combination of the following symptoms persisting for at least 1 month. 1 intrusion symptom, 1 active avoidance symptom, 2 negative alterations in cognitions and mood symptoms, 2 alterations in arousal and reactivity symptoms with functional impairments. The current International Classification of Diseases, ICD-11, offers a substantially different approach to diagnosis based on 6 symptoms organized into 3 clusters: constant re-experiencing of the traumatic event, avoidance of traumatic reminders, sense of threat. To establish a diagnosis, at least 1 symptom from each cluster must be present and persist for several weeks after the stressor exposure. Both diagnostic manuals, ICD-11 and DSM, emphasize the importance of traumatic factors and the duration of stressor exposure, distinguishing PTSD from other conditions with similar symptoms such as anxiety disorders, adjustment disorders, obsessive-compulsive disorder, and personality disorders. Despite extensive research on defining diagnostic criteria for PTSD, it remains unclear which types and degrees of stressors are capable of inducing PTSD. For example, fear during combat trauma is considered a sufficient stressor to cause PTSD. However, other stressors such as shame and guilt also correlate with the development of PTSD and are typical in wartime conditions and related to the routine behavior and actions of military personnel with established moral and ethical beliefs. Additionally, family members of individuals exposed to stressors can also become targets for the development of PTSD. It has been found that pre-war mental health education and prevention programs are insufficient to prevent or mitigate the impact of stressors during wartime. Most research in this field focuses on defining diagnostic criteria and verifying the diagnosis of PTSD. Prevalence of PTSD. The reported prevalence among military personnel and veterans ranges from 5.4% to 16.8%, which is nearly double the rate in the general population. In recent years, there has been an increase in the prevalence of PTSD in the population due to global terrorism and military conflicts. Most contemporary studies primarily examine groups of military personnel and veterans, although PTSD can manifest in any population at any stage of life. The manifestations of PTSD in children and adolescents are not sufficiently studied. In most studies, the prevalence of PTSD among male military personnel, 13%, slightly exceeds the corresponding rate among female military personnel, 11%. However, women have a higher rate of sexual trauma. After returning to civilian life, 44% to 72% of veterans experience high levels of stress. Many veterans with PTSD display problems with emotional regulation and self-control after returning home. Over 80% of PTSD patients have one or more comorbid conditions. The combination of PTSD and traumatic brain injury, TBI, accounts for 48%. Moreover, PTSD is often accompanied by cognitive impairments. What mechanisms underlie the development of post-traumatic stress disorder? What are the strategies for treating and preventing PTSD? Listen about it in our next podcast. Treatment and prevention strategies for post-traumatic stress disorder.